I just wanted to talk a little bit about my DNC. I didn't want to end up having to have a DNC after this miscarriage. I had a DNC after my 4th miscarriage and was hoping to avoid having another DNC. But I had started having the miscarriage on a Saturday, and the following Thursday I had an appointment to have the ultrasound and see how much was left in there and if I was going to need to have an ultrasound, a DNC or not. So went in Thursday for the ultrasound, and it looked like there was still a lot of tissue and everything in there. So they decided that I definitely needed to have the DNC. So we went back and we talked to the doctor after the ultrasound, and the doctor said, yeah, it looks like there's still quite a bit in there, and we really recommend you do the DNC. And so I was thinking, well, it would probably be a good thing to do anyway, because testing purposes, we definitely want to do testing this time around to see if there's something wrong with us that could be causing the miscarriages. And so we thought, it would probably be a good thing to have the baby tested to see if there was anything that we could find out from that. So they scheduled me for the DNC the next morning, so I went in Friday morning. We got there at 6 a.m. and we had to basically wait until about 10 a.m. before they decided to take me back to do the surgery. But during that time they did a blood draw, and then they took me back to get me started with the surgery. But before that, the anesthesiologist came in and he was talking to me and asking me if I'd ever had any general anesthesia before where I'd been put to sleep. And so, of course, I told him, well, yeah, I've had a DNC before. And he said, well, so this is nothing new to you then. And he said, don't worry, we'll take good care of you. And the doctor came in for a little bit and sort of just, basically talked to me about, about what was going to happen. And then she was gone quickly after that. And then the nurse decided to put my IV in the same vein that I'd had the blood taken from earlier. So I got the IV, and then a little bit after that, they finally had wheeled me back to the operating room. And once I got in there, they had put the sedative in, and they put a mask over my face and asked me to take a few deep breaths in and out, and the next thing I know, I was waking up in the recovery room. And of course I was asking how the surgery went, was asking if my uterus had been perforated or anything like that, because that's always a concern with DNCs. You want everything to be okay with everything, so that you can try to have future children or anything like that, and have less healing time and less bleeding and all those kinds of things. So they told me that everything went well with the DNC, and that I would have an appointment in 2 weeks' time to come back for another checkup, make sure everything is still looking fine, make sure everything was out that should be, check my HCG levels again, and also find out the results from the testing of the baby. So this coming up Friday, in 2 days, I will go back for that appointment. If you don't know what a DNC is, then it's basically where they go in and clean out anything that's left inside of the uterus after a miscarriage that you didn't already pass naturally, or sometimes they just schedule DNC as soon as they know that you are going to miscarry, that the baby's heart stopped or anything like that. I will update after that appointment on Friday with the results from the testing, and hopefully we'll be able to schedule some appointments for testing to see why, if there's a reason that we can find out why we've been having recurrent miscarriages. And maybe we'll find out something, and maybe we won't. There's a pretty good chance of that also, so maybe we'll know something then. But either way, we'll keep you updated. Thanks for watching. If you have any comments, feel free to leave those or questions about DNCs or anything like that, you can ask those as well. Thanks for watching. Bye.